The number needed to treat is commonly used to understand the number of patients that need to be treated in order for one to benefit compared with a control in a clinical trial. So let's see how to calculate the number to treat formula. You take 1 and you divide it by the absolute risk reduction, also known as ARR. To better understand how to calculate the number needed to treat, let's have a look at this control trial. You can see that we have an active group that actually used the drug and a control or placebo group that didn't. And you can see the different numbers here for a total of 100 and 100 patients. Now that we have these numbers, we can calculate the absolute risk reduction, which is essentially the difference between the event rate in the control group and the event rate in the experimental group. In other words, it's the difference between patients that risk to remain sick if they are untreated and the risk for patients to remain sick even if they are treated. To calculate the CER, we take 80 from the control group and divide it by the total, which is 100, and we get 0.8. To calculate the EER, we take 85 from the active group, divided by the total, which is 100, and we get 0.85. Now that we have our ARR, we divide 1 by 0.05, which gives us 20. 20 is the number of patients that need to be treated in order for one to benefit from the treatment.
Created using Powtoon.